Going to the doctor can be a daunting experience for many people. Whether it's fear of the unknown or anxiety about medical procedures, it's a stressful experience that can cause real harm to your health. But what if there's a way to alleviate the stress and make healthcare more accessible for everyone? That's where virtual reality comes into play. Virtual reality is a type of technology that lets you feel like you're in a digital world. By wearing a headset, you can see and hear things as if you were actually there. And this technology is not just for gaming and entertainment. It's become an increasingly popular tool for healthcare professionals. Virtual reality can be used to treat a wide range of health issues, from anxiety and depression to chronic pain and phobias. It can even be used to help patients get ready for medical procedures, which lowers the anxiety and makes the whole thing better. Virtual reality exposure therapy, for example, has been shown to be an effective way to treat anxiety disorders. By immersing patients in simulations of the situations that cause them anxiety, they can learn to manage their symptoms in a safe and controlled environment. Virtual reality can also be used to manage chronic pain. By giving patients immersive environments and interesting things to do, they can focus less on their pain and have a better quality of life overall. And for patients who are anxious about medical procedures, virtual reality can be a game changer. By allowing them to experience the procedure in a simulated environment, they can become more familiar with the process and reduce the anxiety about it. But virtual reality isn't just useful in individual patients. It's also being used to improve healthcare outcomes on a larger scale. Medical professionals can use virtual reality to train for surgeries and other procedures. By practicing in a simulated environment, they can gain valuable experience and develop their skills without putting patients at risk. Virtual reality can also be used to plan surgeries and other medical procedures. By creating a digital model of a patient's anatomy, doctors can explore different options and come up with the best plan of action. Virtual reality can even be used to collaborate remotely. By wearing a headset, doctors and other healthcare professionals can work together in real time, regardless of where they are in the world. But perhaps one of the most exciting aspects of virtual reality is its potential to improve mental health outcomes. Virtual reality can help reduce stress and improve overall mental health by putting people in peaceful environments. This is especially important for people who may not be able to get traditional mental health care because of cost or location. Unfortunately, virtual reality is often seen as a luxury that is only available to those who can afford it, but this doesn't have to be the case. There are low-cost virtual reality options available, and as the technology continues to advance, we can expect to see even more affordable options in the future. And community centers, libraries, and other public spaces can make virtual reality available to people who may not have access to it otherwise. Healthcare providers can also make virtual reality available to their patients, regardless of their low income level. By adding virtual reality to their treatment plans, they can improve the results and make healthcare easier for everyone to get. Virtual reality has the potential to revolutionize healthcare and improve outcomes for millions of people. By making this technology available to everyone, regardless of income level, we can create a more equitable and accessible healthcare system for all. In the 21st century, virtual reality has become an increasingly popular and accessible technology, but it has mostly been used in fields like games and entertainment rather than medicine. This is a missed opportunity for medical treatment, education, and research that can potentially benefit millions of people around the world. Accessible and fair use of virtual reality in healthcare is a matter of social justice because it can give everyone, no matter where they live or how much money they have, access to healthcare services. The use of virtual reality technology as a healthcare option should be encouraged and made available to people of all income levels. VR has been shown to be useful in many areas of healthcare, such as physical rehabilitation, mental health treatment, pain management, and medical training. So the next time you're feeling anxious about a medical procedure, or struggling with chronic pain or mental health issues, I want you to consider giving virtual reality a try. It just might change your life. Because VR is immersive, it gives users a unique and exciting experience that can lead to better results than traditional methods. VR can also give patients a safe and controllable place to practice skills or face fears, which can be hard to do in real life. Access to VR technology should be independent of a person's income because that will create health disparities and limit opportunities for people who can't afford expensive equipment. Everyone, no matter how much money they have, should be able to enjoy the benefits of VR technology. By giving people access to VR, people who might not be able to use traditional healthcare services can find other ways to get better. Virtual reality is being used more and more in healthcare for things like training, therapy, rehabilitation, and making healthcare providers more empathetic. But funding needs to be set up to make sure that VR in healthcare is accessible and fair for everyone. One way to fund the development of accessible VR in healthcare is by investing in research and development, as well as partnerships between healthcare providers and technology companies. For example, Cedars Sinai has worked with Applied VR to make VR based interventions for people who have chronic pain. These interventions have helped patients' pain a lot. Also, startups like Firsthand Technology have been given money to make VR apps that help doctors manage pain. Another way to fund the development of accessible VR in healthcare is through government grants and funding. The global market for VR in healthcare is expected to reach 30.40 billion by 2026, and governments can fund research and development in this area to make sure that healthcare providers can access and use these technologies for the health benefit of patients. Here are my recommendations. Number one, encourage the development and usage of VR technology in various health related fields, including physical rehabilitation, mental health treatment, pain management, and medical training. Number two, ensure that VR technology is made affordable and accessible to people of all income levels by subsidizing the cost of VR equipment and providing financial assistance for VR therapy and treatment. Number three, educate healthcare professionals and the public on the benefits of VR technology in healthcare and encourage the adoption of VR as a viable treatment option. And number four, monitor and evaluate the effectiveness of VR technology in healthcare and continuously assess the accessibility of VR technology to ensure that it is reaching all individuals regardless of their income level.